Thank you so much for inviting me to speak today. I'm thrilled to be here and to share with you some exciting innovations and hopefully spark your curiosity in terms of how they might help you to improve the way you deliver aged care services. As you've seen from the bio, I've been lucky enough to work for a large number of global brands around the world, and I've been involved with digital media for many years now. And I've really seen the massive explosion of more accessible, affordable, connected technology and how this has shaped consumers' behaviour. Some people ask me why I'm particularly passionate about healthcare, and really it comes from my own experience as someone with a chronic disease and my interactions over the years with various health services. I feel that the health system has really lagged behind in adopting new technology for consumer engagement. However, I do believe that these new technology tools can improve quality of life, support better workflow, and reduce the cost of care. I'm sure all of you in the room are well aware of the stats of Australia and many other nations' ageing population. The increase in the number of older adults requiring healthcare, the decrease in the ratio of available workforce is creating a squeeze on tax dollars. But I also think we need to address the impact to carers. We know that family members who care for older adults suffer from increased risk of illness and injury and are particularly prone to mental health issues when they do not feel that their loved one is receiving adequate care, and they themselves are often trying to balance the needs of caring for their family, as well as their parents, and often juggling work to pay the bills. It's a very stressful environment. It's an issue I feel that has not been spoken of enough when we talk about the cost of an ageing population. If we're going to have an increase in the number of people needing care, we have to think about the health impact of the people caring for them. We need to look at how we can utilise new technology to improve the way we care for this growing older population and those who care for them. We need to maximise and support our existing workforce, plus look at how we attract younger new people to this market. But most importantly, we need to look at how we integrate the capabilities of the consumer themselves to be more involved in their own care. And I believe technology holds the key. Today, I'm going to give you an insight into 4 key innovations taking place that I feel have a big opportunity for the aged care sector. First up, connected care. The wealth of devices, relative affordability of access, and increase in more usable devices to get connected to the internet has led to the social media revolution of people not just consuming, but creating and being part of content too. Let's start by looking at a video which shows you the impact of social media. Really though, I like to think of social media as a conversation. Content in any format, audio, video, text, games, content created by people for people. Today, conversations in the digital space are accessible, searchable, interactive and timeless. So why is that access important? Well, it can help address social isolation, something that's very dear to me. It seems crazy to me in a world of 7 billion people that so many of us still feel so alone. And it's not just people in remote rural areas. I remember when I first got to London, fresh off the boat, so to speak, from New Zealand, and walking down a very crowded street, and I'd never felt so alone, lost or out of place as I did in that moment. We see a growing number of older adults in Australia from different cultural backgrounds who may need to move away to receive care, and it's of growing importance we look at the impact of social isolation in aged care and how social media tools may provide ways to address this. We know from research that socially isolated people have an increased risk factor for a range of illnesses, and it's a leading cause of concern for aged care residents and their families. This excerpt from a research study shows us a 3-fold increase in heart conditions for every 1 increase in loneliness. When you think of the opportunities to improve that, to not only benefit the person, but also reduce the cost of care, I think it's an obligation for us to look at how we can do this. I'd also like to point out that many healthcare workers and carers, particularly of those looking after someone with dementia, suffer from feelings of isolation themselves, and we need to think about ways we can support those who do the supporting. This is a great site in the US called caring.com that provides a social platform for carers to connect and support each other and find information and help at the times when they need it. Some of the ways we can use social media to address aged care issues are through intergenerational storytelling. Simple, low-cost tools to be able to capture stories through video, audio, imagery and text, and using this as a platform to bring together generations to learn from each other creates a wave of benefit to both parties. This is an idea I had a while back, and I'd love to see it come to life. It's the notion of a vintage skills database. You see, I'd use the term vintage here, not old or aging. Why is it we seem to be able to think of an old pair of jeans as cool, and they're called vintage or retro, yet an older person with history, knowledge and stories, not so? Providing residents and care facilities with the opportunity to share their stories and access this to school kids. So, for example, if I'm a teacher in Sydney and teaching my class of 10-year-olds about the Opera House, I could arrange a video call with Gino, who was actually working on it, and he could answer questions from the kids. This would then be recorded and stored for his family and anyone else interested to view, today, tomorrow, or 100 years down the track. The benefits to Gino of feeling still part of the community and needed, wanted, as well as to the kids to learn from narrative storytelling, I believe would be truly fantastic. Social media, conversations, they have a lot of power, and I believe it's a social solution to social isolation. All of us have the need, and indeed the right, to feel wanted, appreciated, respected, and being part of the conversation, part of a community, can help to fulfill those needs. Access to the internet gives people access to conversations. They can find and take part in all sorts of conversations, or even start a new one of their own. I'd love to see a future where you get a welcome pack that includes a range of digital tools, not just a map of the retirement village and your menu options. Providing digital access to services, I hope, will become commonplace. And I hope not just for the residents, but we will look at the improvements of allowing workers to use these tools to connect and share with each other also. The next innovation I'll talk about is gaming, or gamification of services. Many people think of gamers as someone like this: male, young, low social skills, bit of a loner, and probably playing a fantasy game like World of Warcraft where you kill dragons and complete quests. Yet increasingly we are seeing this: games being played and loved by all ages, and a great way to create an intergenerational bonds as well. With the release of movement-based interfaces like the Wii, the Kinect, the Move, the scope of games is increasing, and we're seeing the benefits in many ways. One of those benefits is being researched by a fabulous man, Dr. Stuart Smith from the Neuroscience Research Centre in Sydney. He's looking at the opportunity of gaming to improve the trip response in older adults. As we see here, the cost of falls to the health system is huge and continues to grow. Stuart and his team have created a version of a popular movement game, Dance Dance Revolution, to help older users practice their stepping, and they're seeing some great results. The opportunities again of connecting the grandparents to dance with their grandkids, who may live 1,000 miles away, is really exciting. The key with any form of exercise, though, is you need to do a lot of it, and using a gaming interface, particularly a connected interface so you can share your experience, helps address some of the barriers to adherence. I believe there's huge opportunity to learn from the gaming community, understanding how to use fun as a method of engagement, to deliver tools that people want to use, but provide benefits as well. I often say that e-health needs a solitaire. When Microsoft first launched Windows, they bundled solitaire with it, not because they wanted to provide a fun game for people, no, because it broke down the barriers of how to use a mouse, right-click, drag and drop, and it got people used to the features of a graphical user interface. Using game design theory or gamification to improve how you design the interface to a range of services for both consumers and healthcare workers will increase usage, decrease time for learning new processes and software, and I believe improve overall operational efficiency. So now let's take a look at smart living. Smart technology in the home, as well as in your pocket, helps to capture information as well as provide safety and security by connecting you to care when you need it. How many of you here have a smartphone? Absolutely. Well, mobile phones and tablet ownership are growing at an exponential rate in Australia. Anytime, anywhere connectivity at an affordable rate, powered by devices with more and more functionality and capability, such as cameras, video mapping, and commercial environments for developers to create applications, has revolutionised the old Motorola brick handset that weighed as much as a small child. And I want to make it clear that this is not just for younger people. The 55 plus age group is growing, and the over 65 is the largest growing demographic for online travel. There's a significant economic opportunity for new business, as well as existing services, to cater to the needs of this growing demographic. I was at a conference recently where someone was talking about the most common question asked at a senior net centre where they were teaching older pensioners how to use the internet was how to get onto online dating. So I think that shows you the tide is really, really changing. To me, the larger screen of the tablets like the iPad, as well as the easier interface, is a huge opportunity for older adults to engage with technology and get connected. I'd like to show you a quick video here of Virginia, a 99-year-old woman who loves the iPad and how it has enabled her to enjoy one of her passions again.
I think this is the start of a poem that I wrote once.
Writing has always been a part of Virginia Campbell's life.
Its glowingly trace on its magical face.
For the last century.
I'm only now 99 and a half, but I consider myself in my 100th year.
But with age,
to read this dictionary, I have to use the loop.
Have come a few new restrictions.
I have glaucoma, and I found recently that I wasn't even able to read large print library books.
And penning her passion became too hard to do.
I could write them all right, but I couldn't read what I wrote.
So that's when her family brought this centenarian into the 21st century with the Apple iPad.
Now I can read again. And it's just opened up the world.
For Virginia, it's the contrast between the bright background and bold letters that bring the story into focus.
And I prefer to read it in the horizontal way with 2 pages. It seems more natural to me.
Instead of just oversized type.
It was as if there was a fog. I mean, I couldn't distinguish it.
And using her first computer months short of her 100th birthday,
it's kind of addictive.
Virginia can only marvel at her longevity.
I mean, when I was born in 1910, they barely had the automobile in any use.
But it doesn't stop there.
Those are free so far.
Virginia is now a YouTube star with nearly 38,000 hits on the video her son-in-law posted online.
Dumbfounded. It was just amazing.
And now for this lifelong writer who's never afraid to poke a little fun.
To this technical ninny, it's clear, in your compromised 100th year,
putting pen to paper has turned into simply pressing on her iPad.
You're never too old to take advantage of something that'll help you.
It's not just mobile devices though. Many of the household items are becoming smarter. Fridges will not just turn off the light when you close the door, but allow you to swipe the barcode of the items when you put them in. And then it can tell you when they're near to their use-by date, as well as provide a shopping list for you. I saw the other day too that there was a fridge that had a camera in it. You could call up from your iPhone when you were away and see if you needed to buy some milk on the way home. Interesting times. I was recently at a conference in the States called Health 2.0, which is about technology in healthcare. And there was a major push to what's called the quantified self, with people wanting to use applications and devices to monitor and track everything, from blood sugars to heart rate, sleep, and even mood diaries. And I believe this push and commercialization model behind it will fuel innovation and new technologies to support monitoring for older adults. It's not just wearable monitoring devices. We're seeing smarter integrated technology in the home, as shown here by geospatial carpets that monitor your movement and can be used not just for assessing falls, but also to monitor gait and movement and pick up on subtle changes to balance so that interventions can be put in place earlier and reduce the risk of falls and possible hip replacement surgery. Take a look at this new application that uses the camera in your iPhone to overlay background historical images onto what you are looking at, so you can take a history tour wherever you are. It's being used too for online shopping sites to put you in the picture and enable you to get a more personalised shopping experience. People are willing to pay for these services, and this is fueling innovation through a competitive commercial marketplace. How can we use this technology in an aged care setting? Help us learn more about a resident's apartment or their overall health by linking all the ambient data together. Studies have shown how access to this data in a simple format that is understandable for the user can help to improve outcomes. Being aware of the activities that trigger health issues for you and enabling you to be an informed and thus empowered health consumer is a shift we will see increasing over the coming years. Access to this data will become increasingly important for healthcare workers to be able to get a clearer picture of the needs of that particular person before they arrive at their home or at their bedside, enabling them to access the relevant data but also easily input new information while they're there. So, I believe we will see an increase in devices, both external and ambient, that collect data and send to intelligent platforms or systems. This will be available through user-centric templates to care workers on any device they choose, and most importantly, needs to be presented in a way that is digestible, relevant, timely, and actionable. Developing platforms to capture this data and provide meaningful intelligent systems to understand it is a vital step that will help us move to a more preventative healthcare model, as shown here by the Business Council of Australia's document, Using Microeconomic Reform to Deliver Patient-Centric Healthcare. It's about understanding how to use technology to enable more proactive care delivery in the home rather than costly reactive care in the hospital. This data flows on to my final topic I wanted to briefly cover, and that's shared electronic health records. Much of the health IT systems are a bit of a mess when you look under the hood. System A doesn't talk to System B. Frontline workers spend far too much time on admin duties, having to re-enter data into multiple systems, and there is significant risk in not only medication errors, but patient transfer and discharge too. The work that is going on with the PCEHR and other e-health initiatives to provide standards to enable a fluid system for data to move freely around the health ecosystem and support workers, providing access to shared, secure source of health data for the whole care team, I believe will be an enormous step forward in improving care. So, in summary, I'd say the opportunities of technology to help you shape the future of how you want to improve the delivery of aged care services is here. Not only will it help you provide better care to residents, but also provide support for their families and loved ones, and provide opportunities to improve working conditions and support for your staff, thus improving operational efficiencies and reducing costs. I hope we will see increasing evidence to prove the cost benefit of investing in these technologies, and that government policy looks to support these initiatives and support older Australians in getting connected and being online. So, thank you for your time. My contact details are here if you want to discuss any of the ideas further. And lastly, I'd like to finish off with one of my favourite TV commercials. It's quite old, but one of the reasons I called my business Flaxworks is that technology works best when you weave it into your business. And remember that it's part of the solution, not the whole solution. Common sense still should reign supreme. Thank you.
I can watch live TV on my new Sprint phone.
Well, my Sprint phone has TV and downloads music.
I can check email.
I have that. And crime deterrent.
What?
Try and take my wallet.
Give me your...
Live TV, wireless music downloads, email, and crime deterrent.
I'm filing a grievance, Ben.
On the Sprint PowerVision network.